Assalamu alaikum. Ultra Scan Diagnostics here. This is the CBCT of the patient that you have requested. The area of interest is the lower left quadrant, and as you can see, we've got significant bone loss between 5 and the 6. This is a teardrop shaped lesion where we have significant periodontal disease resulting in bone loss associated with the distal of the 5 and the mesial of the 6. This is the sagittal view. The sagittal view is the side to side view. On the side to side view, you can very see we have a obturational material in the 5, but you can see that this is clearly very problematic right here. This entire lesion is quite significantly big and involving both the 6 and the 5 at this moment. So the 5 definitely needs to be extracted, and then a grafting procedure needs to be done. We don't see any problem with the obturation of the 5, but on the axial view we will now try to locate for any cracks or any problems associated with this tooth. So here we can see that the lower right 5 lower left 5 seems to have a missed canal right there. This could be a void, but this could also be a missed canal, which is very clearly visible on the axial view, and as we move further down, this void or missed canal remains to be observed. We couldn't see that on the sagittal view, but the extent of this entire lesion can be seen from this angle. So this is the buccal angle, and here you can see the lingual aspect of this infection and this bone loss lesion involving the 5 and the 6. So you can see the mesiolingual aspect of the 6 is also now involved. So we are expecting a GTR or a GBR procedure post extraction here as well. Now, when we look at the tooth from a coronal point of view, the coronal point of view is basically the front to back view. Here also you can see that this is the canal which is missing. This right here is the canal which is missing. It can be seen on the coronal view. The lower right 5, this is where the lesion starts, and as you can see, no cortical bone on the buccal, very, very paper thin cortical bone on the lingual, and now the 6 starts, and then the lesion after the initial area. Here you can see the lingual aspect is still involved, and then it goes away. So if there are any further questions regarding this case, please feel free to reach to our team. We would be extremely happy to help. Thank you very much. The only thing that the doctor needs to be mindful of is that the mental foramen is just below, right here is just below the inferior, the lower left 5, and so while extracting and grafting and cleaning this lesion, this needs to be kept in mind, because at one point there's a very thin cortical plate protecting the mental foramen and the mental nerve from this entire lesion. Thank you very much.